Dr. Vibha Path Labs and Hormone Center was established on 6 July 2003 to fulfill the whole spectrum of diagnostic needs of inhabitants of Moradabad and neighbouring areas, leaving no further need to send samples to Lucknow, Delhi or Mumbai. The basic aim of the laboratory is to generate speedy, accurate and reliable test reports. In our quest to provide quality services, we became the first center in UP to be awarded the ISO 9001-2000 certificate in the shortest time after opening the laboratory. To achieve a world-class establishment, state-of-the-art equipment installed at the most prestigious and premier institutions of the world was imported. It thus became possible for us to run a wide range of tests in the shortest possible time with unmatched accuracy. This sophisticated equipment is supported by a team of highly skilled and dedicated workers. Our front office is very receptive and the enthusiastic staff is always ready to provide information to the patients and help them. Hematology section. The commonest tests clinicians write for a patient include the CBC parameters like hemoglobin, TLC, DLC, ESR and platelet counts. MS93. We are glad to tell you that this fully automated hematology analyzer from France is the only one in Moradabad generating 25 parameter results and graphs, and that too in less than 60 seconds. This system leaves no room for manual error. It helps to pick up various anemias, infections, platelet disorders and blood cancers or leukemias. Microsed system. This highly sophisticated system provides results by standard international Westergrens method in just 30 minutes as compared to 1 hour time taken by conventional methods. Variant HPLC. The variant HPLC system identifies majority of hemoglobin disorders and is renowned as the gold standard in thalassemia testing the world over. It also helps to identify thalassemia carrier state. Clinical Biochemistry section. Prestige 24i. Our body undergoes numerous biochemical changes every second of life. Disturbances in these reactions can lead to various diseases which have to be picked up at the earliest. Our Clinical Biochemistry section houses Prestige 24i as its backbone, in which all the actions are fully automated, including picking up of samples and chemical reagents by separate probes, maintaining reagents at proper temperature by onboard refrigerator, and thorough cleaning of tubes, completely eliminating all possible sources of error. Majority of tests prescribed by the clinicians relate to the functioning of the heart, liver and kidneys. This system performs 400 of these tests per hour and generates extremely reliable reports. It is thus the fastest clinical biochemistry analyzer in Moradabad.
Sampling has been completed.
Diastat. Every knowledgeable clinician and diabetic patient realizes the importance of controlling the blood sugar level. Glycosylated hemoglobin is a valuable tool to assess this control over the last 8 to 10 weeks by LP-LC technique, considered the gold standard for this test. BioLite 2000. The electrolytes in our body play multiple roles in the maintenance of body functions, including the regulation of functions of the heart and muscles. Electrolyte analysis by the most accurate ISE method proves to be indispensable in the diagnosis and treatment of critical patients. Immunology section. We now move on to a section involving very expensive equipment and hence expensive tests. These are expensive as the substances being measured are found in minute quantities in our blood. These include thyroid and other hormones, cancer markers, certain vitamins, proteins, antigens and antibodies. This wide group comes under the umbrella of immunoassays. We have 3 marvelous systems to assay these parameters. The technology we use is the latest most advanced and foolproof. This section is equipped with AIA 600 mini Vedas and strip reader. AIA 600 AIA 600 is a fully automated random immunoassay system capable of measuring a wide range of hormones, including the familiar thyroid hormones and various cancer markers, which mainly help to detect cancers of breast, prostate, liver and ovary. It also measures vitamin B12 and folate levels, which deteriorate extremely rapidly from blood samples and which cannot be sent over long distances for analysis. Mini Vedas. Mini Vedas is a versatile system which utilizes unique alpha technology first used to analyze moon rocks brought by Neil Armstrong. These samples could have contained highly contagious organisms, so the technology had to be foolproof. This technology is now utilized for detection of large number of disease-causing organisms, including those causing jaundice, called hepatitis markers, AIDS and torch infections. DAS SRL strip reader. This is a microprocessor-based strip reader useful to perform tests where automation is not possible. Example, ELISA test for tuberculosis and certain parasitic infections like cysticercosis and hydatid disease. Microbiology section. Microbiology deals with the study of microbes including bacteria, viruses and fungi. We are the first in Moradabad to launch a fully automated advanced microbiology lab. We are also proud to install the first backed alert 3D rapid blood culture and TB culture system of UP and Uttaranchal. Our state-of-art microbiology systems are capable of generating extremely fast and accurate results. Mini API. Unlike the conventional methods, the API automated bacterial identification and sensitivity testing system is capable of giving final report within 4 hours. Backed Alert 3D. It helps to identify infections at the earliest and guides the doctor to prescribe the correct medicines. It reports blood culture within 9 to 24 hours against 5 days required by conventional methods. Tuberculosis happens to be a communicable disease very common in cities like ours. The gold standard for confirmation of tuberculous infection is TB culture. Backed Alert 3D system takes just 9 to 14 days for TB culture as compared to the conventional methods which take 6 to 8 weeks, that is 1.5 to 2 months. As this remarkably reduces the time to reach the definite diagnosis, the treatment can be initiated quickly, benefiting the patient greatly. PCR for tuberculosis. Our laboratory is also the first in Moradabad to install the system for PCR test for tuberculosis. This system amplifies the DNA of TB bacteria very speedily, thus providing quick information regarding tuberculous infection. PCR and Backed Alert 3D system can identify tuberculosis on a variety of specimens including body fluids, pus, urine, biopsies, bone, FNAC aspirates, sputum and even blood, greatly facilitating the diagnosis of tuberculosis. Histopathology and cytopathology. Histopathology and cytopathology mainly involves examining slides prepared from tissues removed after various operations and from aspirates and giving an opinion regarding the probable disease. We also provide digital photographs of